Hi, my name is Kristen and welcome to No Copay Educations. In this video, I'll be doing more practice pharmacy technician based questions for the PTCB exam. If you haven't seen my first video, go ahead and click in the link in the description box, or I'll try to create like a link in the video. So let's get started. Hi and welcome back. In this video, I'll be doing some more practice questions. So the first set of questions, I'm going to go ahead and go over some law and regulation questions. What type of recall by the Food and Drug Administration or the FDA for a medication would deem it to cause temporary adverse health effects for patients? A. Class 1 recall, B. Class 2 recall, C. Class 3 recall, or D. Class 4 recall. Go ahead and take a few seconds to answer the question and click play whenever you have your answer. Did you select B? So it's a type 2 recall. In a type 1 recall, this is when a medication can cause severe health effects like death. In a class 2 recall, this is when a medication can cause temporary side effects. In a class 3 recall, this is when a medication does not cause any adverse side effects. And a class 4 recall does not exist. They only have 3 FDA class recalls. The next question. Of the people in the pharmacy staff, who can legally ask patients if they would like to be counseled? A. A pharmacy intern, B. Pharmacy technician, C. The pharmacist, or D. All of the above. Go ahead and pause and click play whenever you have your answer. Did you click D? So in this case, all members of the pharmacy staff can ask a patient if they want to be counseled. However, only the pharmacist can legally provide counseling to patients. In this scenario, if a patient asks you what type of medications or over-the-counter medications you should recommend for like headaches or stomach pains, go ahead and refer the patient to the pharmacist to be properly counseled. The next question, which law states that all medication products must have directions for use and include safety warnings? A. Federal Food, Drug, and Cosmetic Act of 1936, also known as the FFDCA. B. Pure Food and Drug Act of 1906. C. Isotretinoin Safety and Risk Management Act of 2004. Or D. Poison Prevention Packaging Act of 1970, also known as PPPA. Go ahead and take a moment to answer and click play when you have your answer. Did you get A? So it's the Federal Food, Drug, and Cosmetic Act. So this law, it requires that all products list ingredients, instructions, and safety warnings for the medication for the patient. For the Pure Food and Drug Act of 1906, it requires that the medication follows the safety requirements in order for human consumption. The isotretinoin safety rule requires that any medication with severe side effects should be monitored, and the PPPA law states that it should be child-proof so that children do not access the medication. So the next set of questions, I'll be going over some medication safety questions. So the first question, what term describes any preventable events that may cause or lead to inappropriate medication use of patient harm while the patient is in the control of a healthcare professional, patient, or consumer? A. Knowledge deficit, B. Performance deficit, C. Medication error, or D. Prescription drug abuse. Go ahead and take a moment to answer these questions. Did you get C? So this is an example of a medication error. So a knowledge deficit is whenever the employee does not have the proper training or knowledge to perform the task. Performance deficit is when an employee has the knowledge to perform the task, but it is not applied when they are performing to the situation. Medication error can result in patient misuse, practitioner error, or error in the pharmacy. And then lastly, drug abuse is whenever a patient takes the medication in order to get high. The next question, which of the following information sources is directed towards pharmacy staff members rather than the patients? A. Medication guide. B. Auxiliary label. C. Patient packaging. Or D. Package insert. Did you get D? A medication guide is a paper handout that comes with a prescription with the FDA-approved information for patients about the side effects of their medication. An auxiliary label is like those stickers that you place on the medication bottles. It's a cautionary and advisory label. It's used to stand out any basic knowledge about the usage and storage of the medication. Patient package insert is a document that goes with the prescription. It's similar to a medication guide. Then lastly, a package insert is approved by the FDA and it's attached to a medication stock bottle. This is usually like a folded up piece of paper that is sticky to the top of the medication and can be removed whenever by the pharmacy staff. So, which organization is responsible for authorization of high alert medications across different healthcare settings? A. Institute for Safety Medication Practices. B. Drug Enforcement Administration. C. Food and Drug Administration. Or D. Substance Abuse and Mental Health Administration Center for Behavioral Health Statistics and Quality. Go ahead and take a moment to answer this question. So the answer is A. The Institute for Safe Medication Practice identifies high alert medications. It reduces errors for lookalike drugs, and it minimizes harm. The DEA, this organization is the leading law enforcement for preventing illegal drug distribution of narcotics. It deals with drug abuse and the drug classifications. So I'll be going over like the scheduled 1, 2, 3, 4 drug classifications. The FDA, it protects the public by regulating the safety of the products for human consumption and usage. It looks for the benefits and it makes sure that the benefits outweighs the risk of the product before distribution. Then lastly, the Substance Abuse and Mental Health Organization provides treatment and rehab for patients to reduce illness, disability, and death from substance abuse and mental illnesses. Next, I'll be going over pharmacology. So I think this section is the most difficult, and I made some questions on my own. So the first question, which DEA drug schedule does Ambient fall under? A. Schedule 1, B. Schedule 2, C. Schedule 3, or D. Schedule 4. Go ahead and take a moment to answer this question. Did you get Schedule 4? So here's a little cheat sheet. You guys can go ahead and take a screenshot of this. I think this was the most useful information, and it's the most practical, both in the pharmacy and on the test. So Schedule 1 drug. These are illegal substances. They're not sold in the pharmacy. Example of these are LSD and ecstasy. Schedule 2 drugs have a high potential for abuse and dependency. Only the pharmacist can fill depending on your work location. So I work in retail pharmacy and only the pharmacist can fill this medication. I think it really does depend on which location you work at, because I do have friends that work in a hospital setting and they work in the control room with a pharmacist to fill controlled medications. So example of Schedule 2 drugs are hydrocodone, oxycodone, and Adderall. Schedule 3 drugs, they have a moderate potential for abuse. This could be an anabolic steroid or testosterone. Schedule 4 drugs have low potential for abuse with low dependency, but it is still scheduled. So how I remember this is that most of the sleeping medications are Schedule 4, such as Valium, Ambient, and Tramadol. Schedule 5 drugs have a very low potential for abuse, They're mostly used for antidiarrheal, antitussive, which is to treat coughing, and analgesic, which is for chest pain purposes. So example of this is the Robitussin AC medication. The next question, which medication is used to treat high cholesterol? A. Palix, B. Nitrostat, C. Coumadin, or D. Zocor? Go ahead and take a moment to answer this question. So did you get Zocor? So Palix is also known as paroxetine, and this is used to treat depression. Nitrostat, also known as nitroglycerin, is used for angina or chest pains. Coumadin, also known as Jantoven, also known as warfarin, is used to treat blood clots, and it's also used as a blood thinner. And then lastly, Zocor, it's the correct answer because the other name is simvastatin, and it's used to treat high cholesterol. A trick to remember these high cholesterol medications is that if you look for statin, it's usually the ending for medications that treat high cholesterol. So this next question is the most critically based question that I can think of that was similar to the PTCB exam. I know that I had maybe one or two of these type of questions. There's a lot to it, so just go ahead and take your time and break down the question stem. So which generic name medication has the brand name that is the most similar to the brand name Lanoxin? So in the question stem, they give you the brand name Lanoxin, and you'll have to recognize from the answer choices, which are the generic names, which generic name has a brand name that is similar to Lanoxin. So is it A, insulin gargulin, B, Nevolval, C, finasteride, or D, acyclovir? Go ahead and pause and take your time to answer this question. So did you get A? In the question stem, Lanoxin is also known as digoxin, and is used to treat congestive heart failure. The answer choice A, insulin gargulin, is also known as Lantus, and is used as a long-acting insulin for diabetes. So as you can see, Lanoxin and Lantus are pretty similar, and so that's what makes it correct compared to the other answer choices. So I'll go through the other answer choices. And Nevolval is also known as Bistolic, and is used as a beta blocker for high blood pressure. Finasteride is also known as Proscar, and is used to treat benign prostate hyperplasia. D. Acyclovir, also known as Zovirax, and is used to treat and to help with herpes management. So as you can see, Lanoxin and Lantus are the most similar in spelling compared to Bistolic, Proscar, and Zovirax. So this next set of questions, I'll be going over sterile and non-sterile compounding with that are math-based. So in my last video, I discussed what an allegation is. I think this is the most complicated type of math because I've never learned this in school, and then also I never really used this in the pharmacy. I think this is mostly used in a clinical or a hospital setting. So an allegation math is also known as the tic-tac-toe math, used to calculate how much you need of each mixture to make a desired product. So in the question sum, they'll give you a high percentage of the stock bottle and a low percent stock bottle and a desired percentage that the doctor has prescribed. From there, you'll have to determine how much volume you'll need of each stock bottle in order to create the desired percentage. So here's an example question of an allegation math-based question. So how many milliliters of a 40% solution and a 12% solution are needed to make a 220 milliliter of a 25 solution? Go ahead and take your time to answer this question. So do you get answer D? So in this question stem, they give you the high percentage of 40, the low percentage of the stock solution as 12, and the desired to be 25%. So as you can see, I'm just going to plug in all those values into the tic-tac-toe. From there, you'll take 40, subtract 25 in order to get 15. Take 25, subtract 12 to get 13. You'll be using absolute values, so don't worry about having any negative values. From there, you'll create a fraction. So 13 plus 15 is 28. So you'll take 13 divided by 28, multiply it by the desired volume that you want as the total. So multiplying the fraction by the total volume, you'll get 195 milliliters of the 40% stock solution. You'll do the same for the bottom part, 15 divided by 28, multiplied by the desired volume, and then you'll get 225 milliliters of the 12% stock solution. In order to check your work, you can add up both the volumes, so 225 plus 195 will equal 420 milliliters, which is the amount that the doctor has prescribed for. Next, what is the weight-to-weight percentage of a 412.5 milligrams of nitroglycerin and 33 grams of a compounded prescription? Go ahead and pause and take your time to answer this question. Did you get answer D? So this math problem has multiple steps. You'll have to convert so that the units are the same. So in 1 gram, there is 1,000 milligrams. Converting the milligrams to grams, you'll get this decimal. Then taking the nitroglycerin divided by the compounded prescription weight, you'll get this fraction in grams. Divide it, you'll get this value, and in order to get a percentage, you'll multiply it by 100%. The next question, if gentamicin is available in 80 milligrams per 2 milliliter vials, how many vials are needed to be compounded in an IV bag containing 480 milligrams of gentamicin? Go ahead and pause, take your time to answer this question. Did you get answer C? So in order to find out how many milliliters are needed per milligram, you'll just divide it in order to get this value. Then from the desired amount of gentamicin in the IV bag, you'll take that divided by how many milligrams are in each milliliter, and this is how many total milliliters you'll need in that IV bag. However, in the questions down, they are asking for vials, not milliliters. So in each vial, there's 2 milliliters. Convert that, and then you'll be needing 6 vials in order to create the necessary compound for the IV bag. So that's the end of my video. Thank you for watching. If you have any questions, go ahead and comment below or email us at nocopaytutorials@gmail.com. Most of the questions that I used, I either made it up myself or I pulled from the Union Test Prep, and here's the link. So thank you for watching again. Please subscribe, like, comment, and share with your friends. Thanks. Bye.